Welcome everyone to BabyCenter Answers, a live Q&A series addressing the most common pregnancy and parenting topics by providing experts solutions to help you tackle these life moments with confidence. In honor of Maternal Mental Health Month and BabyCenter's We See You campaign, today we'll be talking about a topic that's really near and dear to my heart, mental health during pregnancy. Nearly 1 in 5 women will experience some sort of mental health condition during pregnancy or within a year of giving birth. So this conversation is a very important one. I'm Olivia DeLong. I'm the senior health editor here at BabyCenter, and I'm joined today by some very great people. 2 of our medical advisory board members, Dr. Sipra Laddha and Dr. Nicole Taylor, and also by Mikah Berg. Before we get started, I would love for our panelists to introduce themselves. Dr. Laddha, could you take it away?
Sure. So my name is Sipra Laddha. I am a reproductive psychiatrist, also co-founder and CEO of LunaJoy Health. Also the mom of 4. So I have a set of twins that are 8, a 5-year-old and a 3-year-old. I'm someone who has not only suffered with postpartum anxiety myself, but have also treated thousands and thousands of women who have had very similar journeys dealing with postpartum depression, anxiety, bipolar disorder, and other mental health issues during pregnancy and postpartum.
Welcome. Thanks so much for being here. Dr. Taylor, do you mind introducing yourself?
Sure. Hi, I'm Dr. Nicole Taylor. I'm a board certified general psychiatrist with a certification in perinatal mental health. I currently work at the VA health system and I teach psychiatry residents about mental health. I'm a member of the board of directors for Postpartum Support International, as well as the BabyCenter Medical Advisory Board. I'm passionate about erasing the stigma of mental illness through community education and mental health advocacy.
Awesome. Thanks for being here. And Mikah?
Hi, everybody. I'm so honored to be on this panel with all of these. Well, my name is Mikah Goldman Berg. I am a mom of 2 very curly-haired girls, like their mama. And I live in the DC suburbs with my husband and my 2 girls, and I work for Postpartum Support International. I work with the chapters program specifically that brings together perinatal mental health advocates from across each state to advocate for their needs in their own state. So thank you for having me. I'm excited to be here and discuss this really important topic.
We're excited to hear your story, and thank you so much for sharing and being here. I'm seeing lots of comments already going in. That makes my heart so happy. So welcome everybody again. We're just excited for this great panel of experts today. As I mentioned before, this is a topic that's really near and dear to my heart. I went through major pregnancy anxiety with my daughter, and I just hope this conversation really helps people who are dealing with some of the same, both during pregnancy and postpartum. As always, I just want to throw out a couple of announcements before we dive in. Please keep chatting and keep asking questions in the chat. We're going to have a bunch of time at the end to just address your questions. So if you would like one of your questions answered, just put it in the chat. We're also going to be posting links to articles and resources throughout. So if there's something that you need or something that you're looking for, please ask our staff. They are behind the scenes sharing links and information. So please ask there. So we have lots to dive in and very little time today. So I'm just going to hop right into it. If our panelists are ready, I'm looking forward to this conversation. Awesome. Dr. Taylor, I think just to start off, I think it's really important for us to start with recognizing the symptoms and signs, and then the risk factors of mental health conditions during pregnancy and postpartum. I think we hear a lot about postpartum depression and the baby blues, which is totally understandable, of course, and super important, but I think it's also really important to understand why we have mental health issues during pregnancy too. It's completely normal. I went through a variety of different traumas and losses during some pregnancies. And so when I was pregnant with a healthy pregnancy with my daughter, I had a lot of anxiety. Dr. Taylor, can you just share with our audience some of the most common symptoms that we can watch out for when it comes to mental health conditions during pregnancy?
Sure, definitely. So when we're thinking about depression in pregnancy, it can look like sadness or irritability, not being interested in doing things, not being motivated to do things, problems with focus or concentration, feeling tired all the time, more than you normally would feel during a pregnancy, problems maybe going to sleep or staying asleep, changes in appetite, and even feelings of worthlessness or hopelessness or guilt. And of course, there's also the chance that you could have thoughts of harming yourself or harming the baby. Those are kind of the depression symptoms that we would look for. When we're thinking about anxiety in pregnancy, it can look a little different for everybody. There's generalized anxiety that's more like constant worrying, can't cut your mind off, racing thoughts, thinking too much, feeling like something bad is going to happen, although you might not be sure what it is. And then again, you could also have problems with going to sleep and waking up frequently, or even having anxiety-ridden type dreams. Often people feel restless or hyper, like they can't sit still. Some people experience what's called a panic attack. It's like when you get short of breath, dizzy, shaky, hot flashes. It can last anywhere from 5 or 10 minutes up to 15 or 20 minutes, but it feels like a heart attack and it can be really scary. Other people can have other physical symptoms like more headaches than usual, more stomach problems, nausea, sort of generalized aches and pains. Your body just doesn't feel good. And then we have specific types of anxiety disorders like OCD, where women might experience these very disturbing, intrusive, like repetitive thoughts of harming the baby. We call those obsessions. Or they may experience compulsive behaviors where they have to do something over and over again to prevent something bad from happening. And then women with a history of trauma may experience what's called PTSD, or post-traumatic stress disorder. That's where you relive the trauma through nightmares, flashbacks, intrusive thoughts, and you want to avoid anything that reminds you of the trauma. So you tend to be on guard, hypervigilant, and avoid everything that might trigger you. So depression and anxiety can look different for different people, but those are the main things that we would be looking for.
Thank you. That's so helpful. Yeah, that PTSD explanation hit home for me, because definitely with those past traumas, you just think about all the things that could go wrong, and that can really start to, just really impact your pregnancy so much. So thank you for just doing that basic breakdown for us. I think a lot of the things that come up in our community are really around, what are those normal pregnancy jitters, those nerves that, there's a lot going on in pregnancy. We worry about birth and we worry about taking care of a baby. How can we determine whether we're just experiencing those regular pregnancy jitters or if it is in fact anxiety or depression, Dr. Taylor?
That's a really good question. I get asked that question all the time. It's normal to have some mood changes and some anxiety during pregnancy. I mean, this is like one of the biggest things that you're going to experience in your life. It's a big transition for your body and for your life. But there are some warning signs or red flags that you should look out for that show that maybe you need to talk to somebody. For instance, if your mood or your anxiety symptoms are causing you to have a hard time taking care of yourself, taking care of your family, going to work, going to school, completing your usual, obligations that you would need to do, affecting your relationships. Those are all big concerns that this may be something that's more serious than the regular anxiety or jitters. And of course, if there are any thoughts of hurting yourself or hurting the baby or your other children, then we would want you to speak to somebody and, get some help as soon as possible.
Definitely. And we're going to have a whole section on how to get help and what types of help there are out there. Thank you so much. And I think although we're focused mostly on pregnancy here today, I think it's really important to be prepared after birth as much as you can be. Obviously, you can't prepare for that postpartum period. But how can we tell during the postpartum period if it is depression or what we call the baby blues?
Okay. Well, baby blues is very common. About 70 to 80% of moms experience baby blues after giving birth. And really what it is it's a change in your hormones and the lack of sleep that leads to these mood and anxiety symptoms. It usually peaks in about 3 to 5 days after delivery, and it usually lasts about 2 weeks or so. It's characterized by tearfulness, just being more sensitive than usual to rejection, feeling overwhelmed, but normally it resolves on its own and with adequate rest, support, some extra TLC, tender loving care, then most women will come out of baby blues. But it can be a risk factor for postpartum depression.
Super helpful. I'm seeing lots of people here in our audience, they're first-time moms. So welcome to everyone. This is, such an important topic, and I hope we're here to help you today. So I think now that we've gone through the symptoms, I'd really like to talk about some of those risk factors for having a mental health condition in pregnancy. Dr. Taylor, I mentioned a little bit about my own story and previous loss. Could you talk about some of those other risk factors for having mental health conditions in pregnancy?
Sure. There are many factors that can increase a woman's risk of experiencing a mood or an anxiety disorder during pregnancy, but you have to keep in mind that this is not like a checklist. Every woman is different. Every pregnancy is different. So we can't 100% predict how a certain pregnancy or a postpartum episode will go. But here are some of the common things that we look for when assessing for risk. A personal history of a mental health disorder or a substance use problem in the past, a family history of mood disorder, particularly in like the women of the family, and history of problems during pregnancy in the women, history of trauma, history of previous pregnancy loss, lack of social support or relationship problems. Obviously, if there's any medical complications during the pregnancy, that can lead to some depression and anxiety and other major life changes that happen during pregnancy, moving, having new jobs, etc. There are some populations of women that are at a higher risk of what we call perinatal mood and anxiety disorders. For instance, military moms, teen moms, moms of multiples. And then this is also probably a good place to kind of talk about some of the health disparities that we see in mental health in pregnancy. Some of you may be aware of the things that have been on the news recently, but African-American women in particular do have a higher rate of perinatal mood and anxiety disorders. Black mothers tend to suffer PMH-C in silence and not get the help that they need. Compared to white women, Black women are twice as likely to have a maternal mental health condition, but about half as likely to receive treatment. Black women are also 2.5 to 3 times more likely to die from a pregnancy-related event than white women. So these statistics can be pretty scary, and there are a lot of theories about, what causes the differences in these health disparities. But the main thing is that women, particularly Black women, need to be aware of these health disparities. They need to educate themselves about depression and anxiety and mental health conditions and other medical complications that can happen in pregnancy and postpartum. And they need to speak up for themselves. If something doesn't feel right, then you got to say something or have somebody else that can help advocate for you, like a partner or a family member or a friend. And then it's really important to find a provider that you can trust. Historically, African-American communities have not been very trustworthy of healthcare and governmental facilities because of things that have happened. So it's even more of a concern for women of color to find someone that they can trust. And that could be, a medical provider, a midwife, a doula, somebody that they can get information from and talk to, and someone that can advocate on their behalf, just to try to even the playing field, if you would.
Thank you so much. I'm so glad you brought up disparities. One follow-up question I just wanted to ask, would you say that, all of these statistics that we see out there can be very scary when it comes to pregnancy loss or mental health among Black women? Would you say that contributes to anxiety during pregnancy and postpartum?
Yes, most definitely. I mean, we're all bombarded by constant information from the media, from social media, from everywhere. And sometimes that information is not correct. Sometimes it's skewed or distorted. So a lot of times people don't know what to believe, and they don't know, where to go get good information. And that's why I say it's really important to, find somebody that you trust, a good, reliable source for information. And honestly, if you feel like something's not right, you've got to speak up for yourself. You've got to ask the questions. Don't be afraid to put it out there, because you know yourself and your body better than anybody else.
Mm-hmm. There really is so much information out there online and so much misinformation, and it's really hard, especially, first time mom, first time being pregnant, you're not sure where to turn. And that's one of the reasons why we do these types of events. Okay, so moving on, thank you so much, Dr. Taylor. That was a great baseline and breakdown for us. I want to get into Mikah's story here. I think many people go into pregnancy having experienced perinatal mood disorders, which can obviously bring an added layer of stress right into the pregnancy. Mikah, so thank you so much for joining us today so that you can walk us through a little bit about your personal experience on this topic. Can you tell us a little bit about your mental health journey?
Sure, absolutely. Thanks so much for having me and discussing this vitally important topic. So I was diagnosed with bipolar disorder when I was 17. And it took a while to find the right cocktail of medications that worked for me. And it probably got figured out, I don't know, by the time I was 21, 22, I was pretty stable, had my medication in place. That's not to say that everything was perfect. It's kind of this lifelong process to kind of figure out how to manage an illness that will be with you forever, and have to be monitored. So I really learned, speaking to what both of you and Dr. Taylor were talking about, how to be a really strong self-advocate about what worked for me, what didn't work for me, what felt right, what didn't feel right, and then also realizing, where the kind of the medication piece of it ends and where I begin and what I needed to do for myself in terms of self-care. For me, I'm a really big swimmer. So that's part of my weekly schedule about where I carve off time to swim and for self-care. Also sleep, making sure that my sleep schedule is pretty actually rigid, especially in different times of the year. Lack of sleep is a trigger for lots of different things for people. So let's fast forward to when I'm older, I'm in my mid-20s and working in DC. I met my husband, I went to grad school, we got married, and we started to, talk about what does it look like to have kids? And I was like, oh man, I really just wanted a dog. So this is a change. And I was really anxious about what that whole process was going to look like. And I am really lucky that I have such a supportive partner. And in addition to having bipolar disorder, I also have polycystic ovarian syndrome, PCOS. So I knew that becoming pregnant was not going to be, it was going to be a challenge. So there was kind of this two component kind of thing, right? So I had, when we were exploring the mental health piece of this, I already had a psychiatrist in place who specifically saw patients with bipolar disorder. And when I told him, I was like, okay, we're ready to think about having kids. And he's like, okay, this is totally out of my wheelhouse. There's a reproductive psychiatrist that works down the hall in the same practice. And I am going to recommend that you go talk to her. And I was like, oh God, okay. So we did. And, Alex came in with me to the meeting, and we had a very candid conversation with the psychiatrist about, these are all of the risks. You're at higher risk for having a perinatal mood and anxiety disorder. She was specifically concerned about postpartum psychosis, among other things, but that was the one that she flagged for me. And, she was like, we will have a plan in place, and hopefully not have to use it, but you need to have a plan in place in terms of who are your support systems, who is the therapist, you need to have a meal train set up, let's talk about what medications you can take, what medications are not going to work postpartum, let's talk about breastfeeding, let's talk about sleep. We really came up with a very strong plan. And you can make all of the plans and not really be prepared. So, so that was the mental health piece of it. And then the PCOS piece of it was that I just was not ovulating. It was like just not happening. And I remember I think it was like 6 months into like attempting to get pregnant, and I was like to my OB, I was like, do you know what you're doing? Like, I think I really need to be like, I need to see a specialist. And he was like, all right, I hear you. And he bumped me out probably earlier than what was normally recommended to see a fertility specialist. And that was like a whole other process where like, there's like intake, they do lots of different testing. It is like a full-time job, just even going through the testing. And they were like, yeah, you're not ovulating. And I'm like, I know. Right. So, you know, they monitored me. And for many of my friends who went through an infertility journey, like mine was relatively short. It took about, I want to say like 9 months to get pregnant. However, like considering the mental health piece of this and that, like, I just was so anxious. I mean, I just remember not feeling like myself. Like I didn't want to leave our house. I was afraid to do anything, especially like once I, became pregnant, it was like, I don't want to do anything to jeopardize this pregnancy. I don't want to go through this again. And it was really scary. So yeah, I was just really fearful. And I also, on top of that, just didn't enjoy being pregnant. It was not fun. It just was not something that and felt guilt about not loving it. And eventually when I had my now 7-year-old, you know, when I had her, it kind of like, all of that kind of felt like worth it. Like I had her, like I worked really hard for this, it all kind of came together. And then, you know, a few months later, my husband was like, we should start talking about having a second kid. And I was like, let's slow your roll. Like, this is not something I'm ready to even think about yet. And to have to go through the fertility treatments again, and like having to think about like weaning off medication and other things. And then when my first was 17 months old, I was pregnant. And I just remember from the first moment of finding that out, I just fell into this very deep depression, which really did not abate until she was nearly a year old. And I am incredibly, incredibly privileged and lucky to have had a medical team that really worked together, and friends and family helping me out, and also eventually found Postpartum Support International and a support group that was critical to my getting better.
Thank you so much for sharing that. You brought up a really important point, I think, about the guilt that we can feel when we have anxiety, or we're, you know, we feel like it's a challenging time during pregnancy, and that guilt that we're not just totally elated all the time and happy. And I think that really plays into, then you just kind of get down even more of a rabbit hole of anxiety and depression. And so I think that's a really important point to bring up. And we can talk about the ways that some of the things that you did that will help, that helped. But I think, thank you again for sharing your story. I know, and being vulnerable. And I know that, you know, I share my story as well, and in hopes that if it helps just one person, you know,
yes,
like, I'm happy.
1,000%.
Yeah.
Yeah.
So I think that, you know, is there anything you can't prepare, like we've talked about before? You absolutely cannot prepare what's to come. But is there anything that you did as you were managing your disorder, and as you were going through your 2 pregnancies, and even in the postpartum periods? Can you walk us through like some of the things that helped you, or what you would say to moms kind of in a similar boat?
Yeah, sure. I mean, right. Like, as we talked about, I wish there were like, these are the 3 things you can do to make sure like you're going to be totally fine. Unfortunately, that's not the case. Right. So like, I think knowing your family's medical history is a huge piece to this. Like, with the power of knowledge, like you really can help prepare yourself and set yourself up for success. And that's like a key piece to it, right? So, you know, what is your family history? How have you had anything previously? You know, to make sure, and setting up your support systems. Like, who's the friend that's going to check in on me this week? You know, someone like, or setting up a meal train. I mean, one of our PSI trainers said, you know, they even suggest moms put like an ice box outside where people can just drop stuff for meals, which I really like that idea. We didn't do that, but if I had to do this again, I would. And I mean, for me, moving my body is a really big thing for me. So swimming was a critical part of like making sure that my mental health was in check, sleep, making sure that my sleep was blocked off, and just really like listening to your body and listening to what you need, and making sure that you have your support systems, I really think are like the best things that you can do, and knowing what resources you have available.
Totally. I absolutely agree with all of those tips. Sleep. I love that you keep bringing up sleep because we all definitely need more of it, and it plays into so much of our daily life. Thank you, Mikah, so much for sharing your story and your tips. And I'm looking forward to hearing some more about the resources that you used later on. Dr. Laddha, I would love for us to start diving into these ways and strategies to keep our mental health in check during pregnancy and beyond. Again, you cannot always prepare for pregnancy prior to pregnancy, but can you walk us through both for women that have, PMADs going into pregnancy, but also that develop them because of pregnancy loss or something like that during pregnancy? Do you have any general best practice mental health tips? Oh, you're on mute.
Here we go. I was going to say I do. So a number of things that I typically think about in terms of preventing PMADs, or at least reducing some of the difficulties that can ensue. I will say it now so we get it out of the way. Sleep is the number one thing that I think about. So making sure that you're getting at least 5 hours of chunk sleep. And I know that it can be really hard and difficult when you're uncomfortable during a pregnancy or when you're waking up to nurse, but really prioritizing that in any way that needs to happen. That's been, evidence-based, and research shows that when we get good sleep, everything is better. And I like to say that sleep is the building blocks upon which all mood and anxiety is built. And so if that's not there, it is very hard to feel better. So thinking about prioritizing that, even coming up with creative solutions. I did the sleep chunking and blocking after my second and third pregnancy because I learned a lot from the first time. And so just really even coming up with a schedule where I wrote down, like, these are the hours that I'm going to be sleeping. These are the hours that someone else is going to be responsible for anything and everything else that happens in the house or with the baby. So sleep blocking is one thing. Prioritizing self-care, which can be a really hard thing to do, but even thinking about like micro self-care, which is, can I take 1 minute in the morning and can I take 1 minute in the afternoon that I can do a simple box breathing, or that I can just give myself, in my room, or take a walk to the bathroom or a walk to the parking lot or wherever it is that you are, to give yourself a minute just to take some deep breaths or do like a breathing exercise to help reset. And so I think typically when we think about self-care, and especially if you have lots of responsibilities, kind of like, how am I ever going to do that? And I like to break it down to like, can you give yourself 60 seconds in the morning? And can you give yourself 60 seconds in the afternoon? And even the basics, like, am I eating? Did I eat in the morning? Did I eat in the, for lunch? Did I eat in the evening? And checking in with yourself, and even getting like an accountability partner, whether it is your partner or someone else, just say like, these are the things that I want to be doing. Sometimes we think that we're doing these things more than we actually are doing these things. So can we kind of work on this together? The last two things that I'll say is figuring out boundaries and assertiveness. And I think that often during pregnancy and postpartum is where a lot of women are really forced to figure this out, because we might be people pleasers or have a, different personality traits that lend ourselves towards bending over backwards and not maintaining good boundaries. And this is actually a really great time to kind of think about, what am I exposing myself to, whether it be media, social media, people, mother-in-law, whoever, right? So what are the boundaries in my life right now that I can help tighten up to help preserve my mental health? Whereas maybe when you're not pregnant, it doesn't matter and you're just kind of used to operating in a certain way. Sitting down and thinking, what's bringing me stress? What typically tends to bring me negative emotions? What's going on in that dynamic? How do I need to put good assertive boundaries in place? And then the last thing I'll say is really making sure that you have a solid relationship with your doctor. I, as a reproductive psychiatrist, see so many women who are either on medication or feeling depressed and anxious, and they don't want to tell their OB. They literally don't want me to share the information with their OB. And I think that really thinking about who you're choosing for your obstetrics care and making sure that you have a really open and honest relationship with that person. And if you don't feel like you can develop one, to find a different provider, someone that you feel really comfortable with, because ultimately you want that person to be able to partner in your care. You want that person to be able to really help support you, whether it's depression or anxiety, and that fundamental trust in the relationship is really important.
I love that. I was just writing a piece, as you know, for BabyCenter and talking about my own provider. It was a personal essay, and I have such a great relationship with my OBGYN, and I feel very thankful for that, right? Because we've been through a lot together, and I think that is really important. And I love the tip to, you know, shop around and find someone who you can talk to and who can work with your other mental health providers, I think is super important. I also love the micro self-care. I think a lot of times we see all these morning routines and elaborate self-care routines, and we always think like, we can't do that. We don't have time for that. I love the 1 minute in the morning. That's like such a great place to start. I know during my pregnancy, my self-care routine, my mornings are like my thing, but that's not the case for everyone. And so I think taking at least 1 minute out of your day to walk a few more steps or take a few deep breaths is such a great tip. One thing that I think we must talk about, and I'm seeing it come through a lot in the comments, it comes up a lot in the BabyCenter community, is medications during pregnancy. Can you give us the lowdown on medications during pregnancy? I think a lot of women worry a lot about whether they had a previous condition and they're, you know, continuing. Can you just give us the lowdown on what we need to know about medications for anxiety and depression or any other mental health conditions during pregnancy?
Yeah, absolutely. I'm so excited to talk about the subject, because I think that just a lot more education is needed in this space, both for patients and providers, whether that's OB providers, psychiatrists, other mental health clinicians. So we also have a lot of data. We have a lot of research that's come out in the last number of years, really looking at this in a much more detailed sort of way. So it used to be the idea that, oop, you're pregnant, get off of everything. You don't want anything to hurt the baby. The thinking is really centered around what is best for mom is often best for baby. And that does not necessarily mean that every single medication is good for baby. And that is something to discuss with your OB, and it's something to discuss with your psychiatrist if you have one. But the idea that all medication is bad for baby is outdated, is not evidence-based. And the other thing that we often weigh is sometimes when there's nervousness around medication, we have to consider the alternatives. So having untreated depression, untreated anxiety, having mania during pregnancy, having psychotic episodes during pregnancy, untreated mental health issues during pregnancy have enormous effects on pregnancy that have been proven, repeatable, studied well. And so sometimes the risk-benefit discussion is around what are the risks of the medication compared to the risks of not treating. The risks of not treating are higher rates of preterm birth, smaller weights at birth, and often lots of downstream effects for infants and potential babies and children of women who have untreated mental health issues during pregnancy. So I would consider that as number one, that not doing anything is not the safe option. We actually have evidence to show that it is not safe not to treat your mental health issues during pregnancy. And this idea, I think that a lot of us women have, that we're just going to power through it, or we're going to control our minds, or we're going to get disciplined, or whatever it is to make the mental health issue not exist, is not reality based. If there's depression, anxiety, or any other disorder going on, it is important that it is well treated. On the other end of that, medication, we actually have a lot of data that many SSRIs, which are the mainstay of treatment for depression and anxiety, are safe. Zoloft is the number one that comes to mind. And so if you are on medication and you find out that you're pregnant, please do not stop taking your medication right away. Go and see your OB. If your OB is not terribly knowledgeable about mental health and seems a little nervous, find a psychiatrist, because the number one most powerful thing that you can do for yourself is make a really informed decision around medication and pregnancy. And there certainly are some medicines that when people get pregnant for bipolar disorder and some others, that we would potentially switch them to a different medication, but going unmedicated through pregnancy with active symptoms is not the recommendation.
Thank you. So, so important. Again, so many questions come in, I feel like on the daily in our community. And I'm sure you see it a lot. And it's probably the first question that many of your patients ask you. I would love to hear, Mikah, if you would just walk us through just to kind of tell us about your medication background and how you kind of, I'm sure you were worried, how you kind of got over that and how you managed that.
So I just want to say thank you to Dr. Laddha for all of the things you just said. I came into this already having like a medication regimen and was terrified of that changing it all because it took like about 5 years to figure that out, like what really worked for me. So when we went in to talk to my reproductive psychiatrist, she said, my main mood stabilizer is fine. My sleep meds were not. I had to get off of those, which was like a very scary thing for me because sleep is such a trigger for me for mania. So I think I was already comfortable with the idea of having to stay or be on medication while pregnant. I did have questions about, the safety and she said exactly what Dr. Laddha said, so that is nice to know. So I don't think there was like a lot of, I think the hardest part was the sleep piece at first. And I actually because I have PCOS, I had an endocrinologist. I also was so anxious. My blood pressure was like through the roof. They were like, maybe you have preeclampsia. I didn't. I was just like really anxious. So I ended up working with the high risk OB in the office. So all of like my psychiatrist, the high risk OB and the endocrinologist all worked together. And they were like, okay, like we need to make sure she's sleeping. We need to make sure her endocrine system is like working. We need to make sure her mental health is okay. So I really had a lot of support figuring that out. And at one point, with my first pregnancy, I had gotten off my sleep medication and was getting like into the hypomanic kind of phase. Which is not a great place for me to be. And, the high risk OB was like, you just have to sleep. Like that's the priority here is we need to get you to sleep. So, my girls, they're 7 and 5 and they're beautiful and fine. And I love being a mom. This period was really difficult for me and, they're okay.
Thank you for sharing that. I think, I hope that helps, our audience just understand that it's okay to have the feelings of worry, but it's just so important to work with your experts. It's so great that you had such a great support system that was talking to one another, lots of doctors involved. I want to also talk, Dr. Laddha, about for women who feel like they need it. So we've talked about medications. Can you go through some of the different types of professional mental health support that women can lean on for help, the different types of therapy, how to find a therapist that's, right for us? I know that can be really challenging depending on where you live and what insurance you have and all that. Can you walk us through that?
Sure. Yeah, that can be a daunting task to kind of figure out the mental health system and to figure out how to get support and care, especially because there are some differences, I think, with the mental health system as compared to the medical system in terms of insurance coverage and in-network and out-of-network and the different types of interventions. And so, there's medication management, and that can be done by a psychiatrist, particularly a reproductive psychiatrist during pregnancy. Often, a general psychiatrist will be able to say whether or not they have kind of comfort in that area, or someone who works with a psychiatrist like a PA or an NP. And on the therapy level, there's lots of different kinds of therapy. The good news is, before I delve into it, is that the number one indicator of a good response in therapy is actually not what type of therapy is utilized, but that you feel good and comfortable with your therapist. And so finding someone who you feel like is there, is listening, understands you is the most important thing compared to the actual nitty-gritty of what's happening in session. That being said, there's a number of different types of therapy. I'll focus on 3 here. One is supportive psychotherapy, which is really when someone comes in, it's a place to talk, it's a place to get things off of your chest. There's not necessarily a lot of structure, and that can be good often for short periods of time or during particularly stressful events, and is time limited and often helpful. The other 2 types of therapy are cognitive behavioral therapy and then more psychoanalytic or psychodynamic psychotherapy. interpersonal therapies. And so the ones that are psychodynamic tend to be much more focused on the dynamics that the patient has in their life, often the dynamic between the therapist and the patient, as well as a lot of early life, the dynamics that develop with their parents, experiences, and how that's informing the way in which you relate to the world now. And that can often be very helpful. And then the other type is cognitive behavioral therapy, which is much more manualized and really focuses on the idea that our emotions are generated from thoughts, and then we do behaviors, and it's kind of a triangle where they all feed into each other. The idea is that we have lots of automatic thoughts, those generate feelings. When we can understand our thoughts better and utilize kind of almost a tagging system to understand what distortions we might be using for those thoughts, then we can provide ourselves reframes and start practicing, just like you practice riding a bike, practicing different thoughts and kind of trying them out. And through this process, you can help decrease your anxiety, or you can help decrease your depressive symptoms, and is very evidence-based, lots of good results from that. So I think that's the biggest takeaway, that therapy tends to be very effective when you found a good fit. And often in the throes of depression and anxiety, the lie that depression and anxiety tell us is that it's never going to get better and that nothing will help. And the evidence is actually the opposite, that therapy is often highly effective, medication is often highly effective, and that lots of people recover from depression and anxiety.
I love that. I think a lot of questions, there's just a lot of questions too coming in about how to find that therapist. Since that's so important, are there things that you would recommend, resources you would recommend, or even things to think about when you're asking questions to a potential therapist?
Sure. Yep. So there's definitely places that you can go to find directories. Psychology Today is one place where you can type in, your zip code and see who's in the area or who has the coverage that you're looking for. There is insurance network. So you can go to your insurance network and let them know that you're looking for a therapist, and they should be able to supply you with a list of people that are in network that are taking new patients. And in terms of, well, the other place is talk to your OB provider. They often have people they work with, or if you're seeing a psychiatrist, talk to your psychiatrist about who they'd recommend. If you're seeing a therapist, talk to your therapist about who they'd recommend for psychiatry and for medication. But in terms of the things that you want to know, if you get on the phone with the therapist and kind of have like a 10 or 15-minute consultation before deciding whether to book the appointments or not, you want to know if they have comfort in your stage of life. So, how do you feel about treating someone who's pregnant or postpartum? Do you have experience in that? Because that is often very important. And then you want to ask them. So I think the best therapists really often do a combination of things. I've never met a purist CBT or a purely psychodynamic psychotherapist, or a purely supportive therapist, but you want to understand a little bit about what their approach is. And so you can say, I'm having, pregnancy-related depression or pregnancy-related OCD symptoms. How do you approach that? And they'll give you a little bit of their spiel in terms of how they think about it. And you can kind of see, does that correlate with what I'm thinking, with what I think will work well for me? Am I a structured person? Do I want kind of homework and deliverables in between each session? That sort of thing. But I think the biggest thing is just gestalt. How do you feel talking to them on that phone for 10 or 15 minutes? Do you feel comfortable? This is someone that you want to then go and see either via telehealth or in person. Do you feel like this is someone that I can have conversation with? And you might not know right away. I'm a big fan of just trying. If you're not so sure, just have an appointment. You don't have to follow up if it's not the right fit, but you got to start somewhere. And getting rid of kind of perfectionism. You're not going to find the perfect therapist or the perfect psychiatrist, but if you find someone who you think might be a good fit, just have an appointment, get started somewhere.
I love that. Yeah, I have this rule that like anything I'm doing and researching, I have 3 options, and I'll talk to all 3 or research all 3 and then make, a very informed decision. So that's kind of what I did with my therapist as well. So thank you for sharing all of that. I think that was super helpful. Mikah, I am really interested to hear what helped you as far as, you mentioned support groups, mom groups. I know that's something that helped me quite a bit. Friends that had been through what I had been through, starting a text chain really got me through my pregnancy. Can you talk about some of those groups that helped you, or just some practices that helped you?
Sure, absolutely. So after I delivered my second kid, I came home and my husband was like, because we had like a 2-year-old and now a newborn, and my mom was like, Mikah does not seem like she's doing okay. And he found a peer support group for perinatal mood and anxiety disorders, and my OB was like, I'm not sure if that's okay. We ended up sending the group to my psychiatrist, who gave the group leader a call, and she was like, you should definitely go to this group. I think it would be helpful. And that really changed how things were going for me, because I did have this huge support network. I had a therapist. I also want to say that Postpartum Support International does have a directory of therapists and other people that are specialized in perinatal mental health, and you can see who's in your state who takes that insurance. So that's a helpful tool that I was not aware of when I was going through this. But finding a support group that dealt with perinatal mood and anxiety disorders was really, really helpful. The leader of the group was also having trouble had trouble bonding with her baby, which is what happened with me with my second daughter. So just having somebody looking at you with knowing eyes, having that support that's like, you are not alone. Like, we all know how prevalent this is. We don't talk about it in every day, but like, this is a really prevalent thing. You're just not alone. You're 1 in 5, and making it destigmatized, making it normal to talk about this. And that was incredibly helpful. And in fact, I then became a peer mentor at Postpartum Support International, where I worked one-on-one with different women, and then also became a facilitator for the bipolar support group, which was also very helpful. It was just, I had never been in that kind of support space before, and it was really great to be able to be in that space as a facilitator as well. So.
That's awesome. It's so great to hear. And again, I think that support, we've all talked about it, is the #1 thing that you can do during these periods of life. So I can't believe that we've got like 13 minutes left here. This has been wonderful information. Thank you guys so much. I would love to do like a rapid fire style Q&A. We mentioned we were going to be taking questions, and there's tons of questions coming in. So I would love to open it up if the panelists are all good with that. If we just have some questions, we love to answer the audience questions, and I hope that we can get to as many as we can. The first question that I think is super important to address, and I think Dr. Taylor, I'd love if you could take this one, about some of the ways we can break some of the stigmas that exist around mental health. We've all mentioned it today. Can you walk us through that?
Yes, definitely. So the first thing is we've got to start talking about it with the other women in our lives. I mean, you may not have a perinatal mood and anxiety disorder, but your friend, your sister, your mother, your aunt, your cousin, I mean, somebody in your circle, 1 in 5 is going to be experiencing this. So we need to start sharing our stories. We need to start coming to things like this where we can learn more information. And on the other side, providers like myself, we're training them through PSI to ask the questions, to do the screening, to make it a normal part of your exam. Just like we check your blood pressure, we should be checking your mood and your anxiety. So it's on both sides of the desk, really, where we need to be talking about these things, normalizing it, because if people don't know, then they can't get the help they need.
Great, thank you. One question that I'm really loving to see in here is, are there resources available for men as well? Mikah, do you have any to share for that?
Yes, Dr. Taylor can also chime in. So PSI has a whole resource bank for men. There's a support group for dads. There's a specialized coordinator for dads. Yes, so there are resources for dads. There's also a directory for people. A specialized coordinator would be able to connect somebody with a psychiatrist or therapist that would be helpful with working with dads. One of the board members that Dr. Taylor works with as part of PSI is a dad that dealt with a PMAD. So yes, there are resources for dads.
I think we're sharing some links in here too. So
great.
helped.
Yes, I just
Awesome.
want to jump in and say it's 1 in 10 dads that experience
Yeah.
postpartum paternal depression. So dads get
Yeah.
postpartum depression too. So PSI is a great resource. We have groups for everybody and everything, but there's a whole section for dads, partners, and for male support people to be able to get help, chat with experts, etc. So that's a really good place to look for things.
Awesome. Okay, Dr. Laddha, I think I have one for you. Can you develop postpartum depression when stopping breastfeeding? So this is for postpartum.
Yep, absolutely. You can really develop postpartum depression at any point after delivery. And I actually hate that we call it postpartum because you can develop depression during pregnancy, and having pregnancy during depression makes you more likely to continue to have pregnancy in the postpartum period. But when you stop breastfeeding, there is a huge fluctuation in hormones that kind of shift from helping you produce milk to down regulating that. And just even that shift in hormones can, anytime there's a shift in hormone, it's a little bit of a vulnerable time. So shift in hormone can trigger an onset of a depressive episode, or can make just underlying depression that was already there, low level, really feel worse and heighten it. So it's possible to develop depression at that point, yes.
Okay, thank you. This question, and I've seen quite a few questions come in about miscarriage, and I just want to say to the people experiencing miscarriages in this audience, our hearts go out to you. Some of us have been there, sending you lots of love, but there's lots of questions coming in about being pregnant with your rainbow baby, and how to kind of calm the nerves. And I spoke a little bit about my exact journey with that. Do one of you guys want to go for, explaining what we can do if we've been through previous losses or, chemical pregnancies, those types of things?
I'm happy to jump in, and I'll keep it short if anyone else wants to jump in too. So this is something I've seen professionally, also experienced personally. I had a miscarriage and then a successful pregnancy after that. And I think that the anxiety is really heightened, right? There's memories from what happened last time and worries about what's going to happen this time, and even just sequence of events that feel familiar, and you're kind of constantly wondering, are we going down that direction? I think what can be really helpful is keeping this idea of mindfulness as front and center, and the way that we can quickly channel mindfulness. I mean, it's a whole practice. There's lots of things to think about around it, but what do I know in this moment? Kind of bringing yourself back to, in this moment, I'm carrying a healthy baby. In this moment, I'm pregnant. In this moment, everything is okay. Because anxiety really often lives in the future. If you kind of notice anxious thoughts, it's always about what is about to happen. And our anxiety sometimes likes to tell us that thinking about that or focusing on it will might be somehow avoid it from happening, or we'll be able to prevent it from happening. But things that we know are really true is just whatever's in this moment. And so it's a harder practice to do than it is for me to talk about up here, but I think definitely a place to spend a little bit of time around, like a mindfulness practice that can help center you to what's actually happening here right now, and make that pregnancy, potentially much more enjoyable, and to be present with this pregnancy as opposed to what's happened in the past.
I love that. I used to tell myself I was so concerned about like the future and the past, but like I needed to focus, on that ultrasound that was going well and things like that. So that I kept telling myself, we're not in the future or the past, we're in the present. And that really like helped ground me. Dr. Taylor, you mentioned PTSD a little bit with regards to miscarriage and loss. Is there anything else you want to share around this topic?
Well, the only thing I would say is, when you've experienced a loss or a trauma, it's not like you can just forget it. I mean, it lives with you. It's part of who you are. And so it's going to be normal to be, to think about what happened before, to want to avoid those triggers, to want to avoid talking about it or thinking about it. But the risk comes that if you, stop going to the prenatal care, or avoid calling the doctor, or, doing things that could be healthy for you, then it could lead to bad consequences. So, I mean, the best thing to do is, like I said, find somebody that you trust, find a good support system around you, and go ahead and put it out there. Just share how you're feeling. You're not alone. There is help for this. It's just a matter of you've got to let people know what's going on and get the support that you need. It does get better, but it doesn't go away. And so I think it's important for people to realize that, we're writing an article together, you know, about loss and how that affects people long term. The key though is to try to stay in the moment, celebrate your victories right now, and have the people around you that if you're having a hard time, you can really just talk to them and get the support you need.
I love that. I definitely found that, you know, everyone encouraged me to keep talking about it, keep sharing. And when friends were asking how I was doing, just like letting them in. And I think that was really it. Looking back on it now, at the time, I didn't even realize how helpful it was. But now just talking about it and thinking about it, I think really shows, like, just talking about it. If you feel comfortable, we're all different, of course, but I love that tip. Okay, a few more questions, I think. One is, you know, I also see a lot of people in here, it's their first pregnancy. How can I keep my mind kind of stable during my first pregnancy? Dr. Taylor, do you have any tips for first pregnancies?
So always do the things that have worked for you in the past before you got pregnant, like eating well, sleeping well, moving, surrounding yourself with supportive people, getting rid of negative people, finding things that you enjoy, things that fulfill you and that, you know, strengthen you. And it's okay to be a little selfish. You know, while you're pregnant, it is about you and it's about the baby. So ask for what you need, you know, and have realistic expectations for yourself, for others. I think that if you can do those things that normally provide a healthy lifestyle and a healthy brain, that, you know, it gives you a better fighting chance, I would say, during the pregnancy.
I like that. Yeah. I think I see a lot of this question as well. And this was something I experienced too. When you have those little symptoms, say you've had a loss or say it's your first pregnancy, and you feel you have a little spotting or a little cramping or a little twinge that doesn't feel quite right. What can we do to, is it call your doctor? What are some of the tips? Dr. Laddha, can you walk us through some things that we could do?
Yeah, I think almost proactively having a plan with your doctor is often really helpful for, you know, very clear parameters, because I think sometimes there's anxiety about what's happening and then there's anxiety about not knowing what the appropriate thing to do is. Am I overreacting? Am I underreacting? Am I bothering the doctor? Am I being a lot? Whatever. And so talking to your doctor and saying, you know, if I'm having spotting, at what point do you want me to outreach you? If this is happening, you know, what are the things that I need to be looking out for that would propagate a call to you, so that it's kind of taken out of your hands and you can leave it to the specialist, right? So the doctor has done thousands and thousands of pregnancies, and if they want to know if you're not feeling, you know, fetal movement after a half an hour or an hour, then it's not on you to make that decision. You can just collect data. Like, this is happening, you know, according to this plan that my doctor and I have previously agreed upon. This is the thing that I'm going to do. And it takes it out of like just your mental space of having to figure out one more thing. The other thing is really figuring out, you know, what cadence of appointments or check-ins or whatever it is that you need. And this can be customized, right? There's things that insurance does cover and doesn't cover, and everyone has a different way of practicing, but that is also something that you can talk to your doctor about. Say, I've had this history, I've had this loss. You know, what are your thoughts? Because they see this all the time. What are your thoughts about what we can do to keep in close communication, or what we can do if I feel like I'm needing more reassurance? And they will let you know what those things are. So I think kind of taking it back to your doctor, taking as much of it off of your plate as possible, and having a plan so that you just feel secure and how you're supposed to respond to things is a good idea. And then the other final thing that I'll mention is, sometimes it's hard to advocate for yourself, but when you think about the fact that you're advocating for your baby, it makes it a lot easier. And so I know for me during my pregnancies, when I was like, am I going to bother her by telling her A, B, or C? It might not be relevant. I kind of went back to like, my job as mom is to advocate for my baby. If this is something that potentially is wrong or, you know, needs attention, it is her job or his job, if you have a male OB or provider, to figure out what to do with that. And so I'm just going to relay information. I'm going to advocate for myself. I'm going to advocate for my baby. And it's a process that I think works pretty well if you keep that frame in mind, as opposed to, am I being too needy, or am I being this, am I being much? So
I absolutely love that. I left quite a few voicemails on my OBGYN's answering machine, you know, but it's just, even just doing the act of doing that, I think is huge because it gives peace of mind. If they don't call you back within 5 minutes, that probably means it's okay. This has just been such a good conversation. We could keep going and going. The questions are just coming in, and I wish we had another hour to go on, but I am just so thankful to you, Dr. Taylor, Dr. Laddha, Mikah. This was such a powerful conversation, and one where I'm like almost tearing up because it is so important. And I think this is the way that we're going to break that stigma that we've been talking about. So I'm going to have to end this, but thank you again to our panelists. I just hope that moms feel more empowered by this conversation, less alone. We see you, we hear you, we've been through it ourselves, and we're all here to support you. I hope that this conversation really, you know, empowers you to feel good about entering pregnancy and the postpartum period. I do want to share quickly a few resources with everyone before we go. All of our panelists have shared their top resources, so I'm going to share those here, and they've been shared in the chat throughout the webinar. But of course, BabyCenter, we're always here for you. Postpartum Support International, LunaJoy Health, Perinatal Mental Health Alliance for People of Color. And remember, if you need help, you can always call the PSI helpline at 1-800-944-4PPD. Thanks again to our panelists. Thanks again to the BabyCenter team. I'm just so looking forward to the next BabyCenter Answers Live event. Thanks, everyone.